to all of you. My name is Georg Pettersen.
I think my experience being a time in Banda Aceh, I'm very impressed by the efforts done from the government side, from the armed forces, from the health workers, and from international agencies, that be from the UN side and from NGOs. I think there are really tremendous efforts which have been done, and I think a lot of achievements in a very, very difficult situation has been made.
The surveillance system that UN has done there. And
I think the biggest challenge of setting up a surveillance system is to collect information. I think first of all there has been a good coverage of healthcare support to tackle any individual cases. For instance, we had maybe 30 plus number of measles, and quite rapidly they're able to start immunisations of children between 6 months and 15 years living around these detected cases. And in similar ways, there, as is mentioned before, there are on a daily basis report of small number of diseases which are being investigated. So I think the presence of many organizations, NGOs, UN agencies, and with the government help, been able to treat the cases, as well as preventive measures has been taken when there have been disease outbreaks. So I think established at the moment the laboratories are linked to the
where we see us helping the Ministry of Health and the UN in general, helping the government.
Part of the regular, let's say, investigation of cases in hospitals. But from WHO side, we have depended on agencies, that be NGOs, any Red Cross, anybody who has delivering healthcare to report back on suspected cases. And this has been functional quite well, because the agencies have been able to communicate this either by telephone, by email, or by written messages. And we set up both a 24-hour hotline for reporting of possible outbreaks, but a system of weekly reporting of normal diseases.